Do you know what the hemoglobin A1C test is and why it's important? This intriguing question leads us to the world of medical science and the crucial role it plays in managing our health. The hemoglobin A1C test, also known as the glycated hemoglobin test, is a significant player in this field. It's a simple yet powerful blood test, primarily used to diagnose and monitor type 1 and type 2 diabetes. The unique aspect of this test is its ability to measure the percentage of sugar-coated hemoglobin proteins in the blood, providing a snapshot of blood sugar levels over the past 2 to 3 months. It's like a time machine, giving doctors a peek into your body's past to better manage your future health. So let's dive deeper into understanding this test and its significance. You might wonder, how does this test work? Well, let's dive right into it. The hemoglobin A1C test, also known as the glycated hemoglobin test, operates on a fascinating principle. It measures the percentage of hemoglobin proteins in your blood that have sugar attached to them. Now, hemoglobin is the protein in red blood cells that carries oxygen throughout your body. When blood sugar levels are high, glucose attaches to the hemoglobin. This combination of glucose and hemoglobin is what's referred to as glycated hemoglobin. Here's where it gets interesting. As more glucose enters your bloodstream, more of it attaches to the hemoglobin. Consequently, the percentage of glycated hemoglobin in your blood increases. This is why the hemoglobin A1C test is such a powerful tool for monitoring blood sugar levels. It gives a snapshot of how well your body has managed blood sugar over the past 2 to 3 months, which is the lifespan of a red blood cell. Now you might be thinking, what does a higher A1C level mean? Well, a higher A1C level indicates that your blood sugar control has not been optimal. This can lead to an increased risk of diabetes complications. For most adults with diabetes, a target A1C level of less than 7% is common. But remember, the specific target may vary depending on various factors such as age and overall health, so it's essential to consult with your healthcare provider. It's important to note that the hemoglobin A1C test is not a one-size-fits-all solution. It's part of a comprehensive approach to managing diabetes, which includes regular self-monitoring of blood sugar levels at home with a glucose meter. The hemoglobin A1C test is therefore a valuable tool in managing diabetes effectively. It provides a long-term view of blood sugar levels, allowing healthcare professionals to assess how well a person's diabetes treatment plan is working and make necessary adjustments. In the end, understanding how this test works helps us appreciate its importance in the fight against diabetes. Now, let's understand what the test results mean. When we talk about the hemoglobin A1C test, a common target level is less than 7% for most adults diagnosed with diabetes. But what does that actually mean? Well, the A1C test measures the percentage of sugar-coated hemoglobin proteins in your blood over the past 2 to 3 months. Hemoglobin is the protein in your red blood cells that carries oxygen. When glucose, or sugar, in your body attaches to this hemoglobin, it forms what we call glycated hemoglobin. The percentage that the A1C test provides us with is a reflection of how much of this glycated hemoglobin is present in your bloodstream. If the percentage is less than 7, it typically suggests that your blood sugar levels have been well controlled over the past few months. But what if the percentage is higher? Well, higher A1C levels signify that your blood sugar control isn't as optimal as it could be, indicating an increased risk of diabetes complications. These complications can range from heart disease and stroke to kidney disease, nerve damage, and even eye problems. It's important to remember that while the A1C test is a valuable tool in managing diabetes, it's not a standalone solution. Regular self-monitoring of your blood sugar levels at home with a glucose meter is still essential. This allows you to keep track of your daily blood sugar fluctuations and make immediate adjustments to your diet or medication if necessary. Also, keep in mind that individual target A1C levels can vary. Factors such as age, the duration of diabetes, other health conditions, and risk of hypoglycemia can influence your personal A1C target. Always consult with your healthcare provider to establish a target that is safe and realistic for you. Knowing your A1C level can help you and your doctor make necessary adjustments to your diabetes management plan. Understanding your test results and what they mean for your health is a crucial step towards successful diabetes management. Remember, knowledge is power in the journey towards optimal health. So, how can you keep track of your blood sugar levels at home? Well, the good news is that you don't need a laboratory or a medical degree to do this. All you need is a glucose meter. This handy device can provide you with real-time information about your blood sugar levels right in the comfort of your own home. Now you might be thinking, why is it so important to monitor your blood sugar levels? The answer lies in the connection between these daily readings and your hemoglobin A1C levels. Your A1C level is a measure of your blood sugar control over the past 2 to 3 months. By keeping an eye on your daily blood sugar levels, you can get a pretty good idea of what your A1C levels might look like. Here's the deal. If you have diabetes, maintaining a steady blood sugar level is key to managing your condition. Any spikes or dips could indicate a need for adjustments in your diet, exercise routine, or medication. And this is where your glucose meter comes in. Think of your glucose meter as a compass guiding you on your journey towards better health. It can help you understand how different factors like food or physical activity can affect your blood sugar levels. This valuable information can empower you to make informed decisions about your diabetes management. And it's not just about avoiding potential complications. Achieving your A1C target can also bring about a sense of accomplishment. It's like reaching the summit of a mountain after a challenging climb. But remember, just like any journey, reaching your A1C target is not a one-time event. It requires consistent effort and regular monitoring of your blood sugar levels, so don't forget to use your glucose meter regularly. Remember, regular self-monitoring can give you an insight into your blood sugar control and help you reach your A1C target. After all, knowledge is power, and in this case, it's the power to manage your diabetes effectively. It's important to know that certain factors can affect the accuracy of your hemoglobin A1C test results. First, let's talk about hemoglobin variance. Hemoglobin is a protein in your red blood cells that carries oxygen. However, some people have variants of this protein, which are slightly different in structure. These variants can interfere with the A1C test and lead to results that may not accurately reflect your average blood sugar control. Certain populations, particularly people of African, Mediterranean, or Southeast Asian descent, are more likely to have a hemoglobin variant. These variants can cause the A1C test to under or overestimate your average blood sugar level. For instance, the variant hemoglobin C can lead to a falsely low A1C result, while the variant hemoglobin S can result in a falsely high reading. Next, it's important to understand that certain conditions can affect the lifespan of your red blood cells, which in turn can impact the A1C result. For example, if you have anemia or hemolytic conditions where your red blood cells don't survive as long as they should, the A1C test might underestimate your average blood sugar control. Conversely, if you have a condition like iron deficiency anemia that extends the lifespan of your red blood cells, the test might overestimate your average blood sugar level. Lastly, recent changes in your lifestyle or treatment plan can also affect your A1C result. If you've recently started a new medication or made significant changes to your diet or exercise routine, these changes might not yet be fully reflected in your A1C result. Therefore, it's crucial to always consider the A1C test as part of a comprehensive diabetes management plan, rather than an isolated measure of your blood sugar control. In conclusion, while the A1C test is a valuable tool for monitoring blood sugar control over time, it's not infallible. Factors such as hemoglobin variance, certain health conditions, and recent lifestyle changes can all impact the accuracy of your test results. Always consult with your doctor if you have questions or concerns about your test results. To sum up, the hemoglobin A1C test is an essential tool in the diagnosis and management of diabetes. It operates by measuring the percentage of sugar-coated hemoglobin proteins in your blood, providing a snapshot of your blood sugar control over the past 2 to 3 months. Understanding your test results is crucial. A common target. A 1C level for most adults with diabetes is less than 7%. Higher levels indicate poorer blood sugar control, increasing the risk of diabetes complications. In the realm of self-care, monitoring your blood sugar levels at home with a glucose meter is vital for managing diabetes and tracking progress towards your A1C targets. But remember, certain factors like hemoglobin variance can affect the accuracy of your A1C test results, particularly in certain populations. So, stay vigilant, stay informed, and most importantly, stay proactive in your health management. Remember, understanding your hemoglobin A1C test results can empower you to manage your diabetes effectively. Stay healthy and informed.